The treatment process is tough. It's called exposure response prevention treatment, ERP, and it's just a fancy term for doing just what that title suggests. A therapist will help you expose to some of these OCD triggers, these OCD fears and obsessions, and then essentially will work with you to prevent you from responding in the way that your OCD would have you respond. Now that's excruciatingly difficult, as you can imagine, but it's the only way that you can just face down the fear. The irony of this particular disorder, OCD, is that those of us who battle these thoughts and these urges to act in these various nonsensical fashions, we are acutely and painfully aware of just how ridiculous this is. I'm one of the very fortunate people who has benefited greatly from a medication like the SSRIs, and largely what they do is, in my mind, decrease the level, the volume level, if you will, of the thoughts or the intensity, and that just allows me a little bit more leverage to do the hard work of ERP. Whenever I talk about medication in my outreach, I'm always really quick to point out my own bias, which is medication without learning the behavioral therapy treatment process, to me, is too much like a bandage. My first book is called Rewind, Replay, Repeat, a memoir of obsessive compulsive disorder. And in that, I share my story. And I talk about this incredibly elaborate double life that I led for a number of years. And I talk about a framework that I developed out of necessity to allow myself to stay motivated in doing the hard work of ERP. My new book is called When in Doubt, Make Belief. Life Lessons from OCD. The long and the short of the message of that book is the only way to live with uncertainty is to embrace that uncertainty, to sit with the discomfort of it, and do so for what I call a greater good. And it's proved to be a pretty effective way of sitting with all kinds of uncertainty that extend beyond just OCD.